But anyway, I wanted to thank everybody for joining us tonight and for participating in the Holland Library's virtual programs. We really appreciate it. Tonight, we're honored to welcome Dr. Cedrick Batchateu, a hospital pharmacist and wellness advocate who speaks on a variety of health issues, but tonight he's going to address boosting our immune health. So welcome, Dr. Batchateu.
Thank you so much. And just to give everyone just a heads up, I know some of you will have questions, so I would ask that you would simply write them down or type them in the chat box. The reason I say that is because it's a lot easier to go through this presentation without having to stop. And I stick around for about 30 minutes and I will answer any and all of your questions. I think it's never been not insufficient time. So I will answer everyone's questions and we'll have these discussions. So don't hesitate. But just for the sake of transitioning and going forward in a smooth and orderly manner, I think it's best that we save questions until the end. Now, I do like to engage with the audience and make this interactive. So occasionally I will be asking you questions. So please do not hesitate to engage. So now I believe I have to share my screen. Do I have that ability? Did you give me that ability, Janet?
You do. Go right ahead.
Oh, okay, thank you. Now, to begin, okay, let me just share my screen. Okay, can everyone see that okay? Mm-hmm. Perfect. Let's just start my slide presentation. Okay, now, just to begin, first and foremost, I'd love to thank the Holland Township Library for facilitating this. I'd like to thank Janet for being the contact who facilitated this. I know we've been talking for a while. And so I hope that this will be something memorable and everyone will truly benefit from what you learn. Now, this is my most popular seminar. I believe last month I presented this 6 or so times to the different libraries. And this month I'm on track to presenting it 5 times so far, this particular topic. So there's certainly a hunger out there for it. And what I love is that in the maybe 15 times that I've presented this topic, not once has anyone, been disappointed is the point. So, and I do get feedback and I do improve continually from everyone who participates. So in the end, I'm going to give you a link where you guys can all leave me. It's a 30-second feedback. So I would really appreciate that. But, I have maybe 100% of those who've attended this particular seminar have said they've learned something, and that to me means a lot. And so I hope that this will be the same with you all. So without any other hesitation, let's begin. For those who may or may not know me, I'm Dr. Cedrick Batchateu. I created Cedrick Wellness Resources as a way to bring relevant health information to people. Without, being confined to work or the hospital or anything like that. I think it's just nice to be able to talk with people and tell them what you really think without worrying about, oh my gosh, you have to stick to script, what is taught. No, you can actually tell them what you think. And so it's a nice platform where we can have this conversation, but it's also a platform where, I can offer a lot of virtual and concierge health and wellness services. So with my mission with this is really to promote better health. Not only this seminar, but every seminar that I have. The idea is from start to finish, when this seminar ends, you will have a greater understanding of your health, of your body. And so with that being said, I am a graduate of Albany College of Pharmacy, the class of 2013. I obtained my doctorate of pharmacy, and my style is a combination of diet and lifestyle combined with medical. All right, that's what I consider to be wellness. Today, we have about 11 different topics that we speak on, this one being COVID-19. I've been speaking for about 6, maybe 7 years now, almost 7 years. And if you want to learn a little bit more about us, visit our website, drced.com. Let's begin. So I want to thank everyone for being here. Today's topic is COVID-19. We're going to look at COVID-19, at the virus itself. Then we're going to look at the symptoms that are affiliated with COVID-19. Then I want us to look at risk factors. Then we're going to talk about the COVID testing, the immune system. This is crucial to everything that we're doing, actually. Prevention. And we're going to conclude. Now, all of this is going to take roughly 1 hour. And then we're going to transition into Q&A. And, like I said, I'm going to set aside about 30 minutes. So any questions that may arise, if they are not answered as we progress through the slide, please just write them down. We'll address every question. Now, COVID-19. It's really impacted our lives for the better part of a year, right? It all started back in early 2020 when a new virus made headlines around the world. The origin, according to the World Health Organization, the origin of this virus was traced back to a region of China called Wuhan, more specifically a flea market or a food market there. Now, this is an area where they sell all sorts of exotic animals and different things. But what was significant about this new found virus or strain of a virus was the speed by which it spread around the world. Now, of course, we live in a globalized world where someone from China can go to Europe just as easy as they can go to America and Africa and Asia. And so naturally, the virus, within a fortnight, the virus was everywhere. Now, of course, worldwide, we see that it's been responsible for tens of millions of infections. To date, over 92 million people have tested positive for COVID-19, with about 2 million of those people having died. Now, looking back here in the United States, we've had over 23 million infections and just over 400,000 people lives have been lost due to this pandemic. Now, what makes it a pandemic is the fact that it's not confined to a particular location or region. It has spread all over the world. So now if it seems like World Health Organizations and the CDC and all of these health organizations are playing catch up with the pandemic, it's because it is. They are playing catch up. No one seems to be able to get a handle of things. Now, the truth is, coronaviruses are nothing new. We've known about them for a long time. We know, for example, that they are zoonotic. What that means is they generally develop in animals, and then they can then be transmitted to human. Now, this transmission is due to close contact or close proximity to said animal. Now, according to the original theory that the World Health Organization had put forth, or China had put forth, someone in Wuhan had gone to a flea market and had purchased some sort of bat or some sort of animal, and that had the virus within it, consumed that animal, and the virus transitioned from the animal to the human. And of course, the human went about their lives and coughed on people and breathed on people, etc. And so the virus was able to spread throughout China and ultimately the world. Now, that's the official story. It may have changed. I know there are different variations of it. No one really knows the truth, but that's what they said at first, and that's what I remember. Now, officially, the virus is called SARS-CoV-2. So where does COVID-19 comes from? Well, it comes from the fact that the name is coronavirus disease of 2019. So they took the first two letters of corona, first two letters of virus, and the D in disease, and added the 19 there, hence COVID-19. Fewer syllables, much easier to say. Now, the reason it's called a coronavirus is due to the proteins, those things, they're called poplomers or crowns that are sticking out of it. I mean, if you take a look at the illustration on the right, you're going to see they're dyed in red. You see they stick out almost like a crown, which allows them to enter your cells and hijack them easily. Now, of course, what is significant about this virus when compared to other viruses is the speed at which it is transmitted from person to person or animal to person to person to animal, etc. Now, the virus is transmitted from person to person through air droplets. What this means is, as you and I are talking or having a conversation, you may not be able to see this, but there are tiny droplets, air particles, or saliva particles that are being emitted from my mouth, or sometimes when you breathe, if you're breathing heavy, they're being emitted from my body into the air. And if I'm facing you, then they're heading in your direction. Now, within that, you're going to find particles of this virus. Now, it's a respiratory virus, like all the other coronaviruses. This one is a respiratory virus. So you want to look at the lungs to see where it has its it causes its damage, and where it leads to infection. And of course, what's notable about this is the length by which it can survive outside of the body. Typically, when you, let's say you were to cough on a surface, we found is that those bacteria or viruses, they die in a matter of few seconds, but this one supposedly lingers for hours. This means that if I had the virus and I sneezed on my laptop, let's say, and I walked away and someone came in and touched my laptop maybe 2 hours later, it may be possible that there may be traces of the viral particle right there, and for them to be infected with. So these infectious particles can actually linger in the air for hours. Now, of course, despite all these methods of spreading, the most common way in which COVID-19 spreads from one person to another is through close contact with someone's respiratory droplets. Now, for much of 2020, when this virus made headlines, we really didn't know how to go about protecting ourselves. And the CDC and the World Health Organization both came out and issued three things. First thing they suggested was, well, we've got to keep ourselves separate from other people because we don't know who exactly is infected. So social distancing, they advocated staying at least 6 feet from people. That way it would reduce the reach of your air particles. If you sneezed or coughed or something like that, they would have enough distance where maybe it wouldn't reach them. So especially if someone was sick or they were infected, you really didn't want to expose yourself, especially if you're at work or at school or any close-knit area. The second thing they suggested was to wear a mask. Now, contrary to popular belief, the mask doesn't actually protect you from somebody else's viral particles or air droplets. The mask actually protects them from your air droplets. So as I'm talking or as I sneeze, the air droplets go outward. Okay, they go outward in the direction that I'm facing. However, when you're wearing a mask, those same air droplets, they go downward because the mask muffles the sneeze or muffles the cough or it muffles, the trajectory of your air droplet. So it actually goes downward and sort of sticks to your clothes or your own person. And the third thing they suggested was washing your hands. Now that it sounds like common sense. And when you cannot wash your hands, you certainly want to use hand sanitizer. Now, I will say this, the overuse of hand sanitizers can lead to resistance, can get the same microbes to develop resistance to that hand sanitizer. So I would ask that you use hand sanitizer sparingly and stick to the soap and water. So we know that COVID-19 or coronaviruses are respiratory viruses. So much of what they do is going to be found along your lungs. We're learning new information about this virus each and every day. So for example, we know that it has an incubation period up to 14 days. That's 2 weeks. So it ranges from 2 days to 14 days. Now, what this means is it is possible for someone to be infected with the virus and not know because they don't show any symptoms. So they don't know that they have the virus because they are asymptomatic. And so in that scenario, they would be going about their regular lives and, talking to their coworkers and hugging their wives or their husbands and kissing their kids. and, you know, hugging their parents and grandparents and everything. Now, because they don't show any symptoms, they have nothing to worry about, or at least they don't think they have anything to worry about. But in that time where they are asymptomatic, where the virus lies dormant, they are still spreading it. The virus is still replicating within the body. And so this is why it has been very difficult for any country, really, most countries, I would say, to really get a handle on COVID-19. It's been too extremely difficult because we're always playing catch up. We don't know who has it and who doesn't have it. That's why testing has to be frequent and common. Now, the asymptomatic spread is really why this virus is uncontrolled. So, because most people that are spreading COVID-19 have no idea that they have COVID-19. Okay. However, there are some symptoms that should be a giveaway, or should prompt you to maybe get tested or look into whether you have COVID-19 or not. Well, first, some less common symptoms include sore throat, headache, muscle ache, you know, pink eye, and even a runny nose. But those are less common symptoms. What's typical of a COVID-19 infection is really shortness of breath, worsening cough, fever, chills, and even fatigue. Now, for a few of those patients, a minority of those patients, okay, those who get infected, most people who get infected will you know, survive, I suppose. But those who tend to get hospitalized are the ones who develop severe symptoms. What we're talking about are things such as troubled breathing, bluish lips, or blue face. That's due to the lack of oxygen that's entering your body, chest pain, confusion, and even drowsiness. So if you or a loved one are experiencing any of these symptoms, then you are encouraged to call 911 or emergency services, because because at that point you want to make sure you get to a hospital fast. Now, one of the saddest things that we experienced was, one of the reasons why a lot of people died is because early on, a lot of the symptoms of COVID-19 mirrored those of the flu. And if you remember, COVID hit us really in February. I mean, it was here before that, but you know, it seems like by February is when every other newscast, every night, they were talking about COVID-19. And so February tends to be a cold month in New York, in much of the Northeast. So because of that, you know, people were still thinking about the flu. So because of the fact that people did not know the differentiating symptoms between COVID and the flu, a lot of people mistook their COVID infection for the flu. And so what did they do? They may have taken Theraflu, or gone ahead and gotten a flu vaccine, or gone ahead and you know, taken you know, any sort of over-the-counter flu medication that they typically take. But unfortunately for them, this was not the flu. This was COVID-19. So I want to show you the difference between the flu and COVID-19. So first, I want to talk to you about the R naught number. So this value tells us how many people one person infected with said virus is likely to infect throughout the course of his infection. So typically, someone who is infected with the flu will infect 1.3 other people. Okay, that's math. Don't ask me, but you know, they'll usually affect 1.3 other people. Whereas someone with COVID-19 will infect up to 2.5 other people. So there we see that the rate of infection with COVID-19 is twice as great. Now, let's take a look at incubation time. With the flu, you have an incubation time of up to 4 days. That means that within about 4 days, you're gonna know you have the flu due to the symptoms that will manifest. Whereas with COVID-19, you can have it up to 2 weeks, 14 days, and not know, okay? Usually around the 14-day mark is when the symptoms will begin to manifest. So now the challenge is, once you're diagnosed positive with the flu, with the COVID-19, now you have to make a list of everybody that you interacted with over the last 14 days, and you've got to call them and you've got to let them know they need to get tested. Now, I don't know about you, but I don't remember what I ate 3 days ago. okay, let alone who I spoke to 14 days ago, right? So that seems to be the difficulty in controlling this, in containing this, because again, I don't know too many people that are going to know everyone they came into contact with over the last 2 weeks. But another thing to look at is hospitalization rate. Typically with the flu, you have a hospitalization rate of about 2%, which means 2% of those at any given year who have the flu will end up in the hospital. Whereas with COVID, you're looking at about 19%. 19% of them. And this, for those of you that are in healthcare, I know that at my hospital, what we've experienced are, instances where we've been overwhelmed. We've had months where we were just overwhelmed. We're running around like chickens with our heads cut off. And just at the sheer number of people that are being admitted due to COVID-19. So, this is something that has really severely impacted healthcare systems all over the country. Now, when we look at fatality, the flu generally has a fatality of 0.1%. Usually the worst thing about the flu is that, it'll get you sick. Maybe you'll take a few days off of work, but the fatality rate tends to be 0.1%. However, with COVID-19, you're looking at a fatality rate of up to 3.4%. So it is much more significant than the typical flu. Now, of course, with the flu, we know that we can get the annual flu shot, we can get Theraflu, we can get Tylenol, we can get over-the-counter medications to really help suppress the symptoms of the flu. Whereas with COVID, for much of 2020, we really didn't have anything to go with, except for the fact that we should social distance, we should wear a mask, and we should wash our hands. It wasn't until the latter part of 2020 that we developed vaccines, Pfizer and Moderna's mRNA vaccine. So for much of 2020, we just didn't have anything. Now, what are some similarities between the two? Both are respiratory viruses, so they they infect new hosts or other people through respiratory droplets, breathing on people. They have similar symptoms, okay? Symptoms including fever, fatigue, cough, sore throat, headache, and even runny nose and body ache. So, but what differentiates COVID-19 from the flu, okay, is the troubled breathing. This is perhaps the most telling sign that what you have is not the flu, right? Because again, COVID colonizes your lungs, it colonizes your respiratory tract, and it is causing damage. And so, when you feel yourself unable to breathe properly, okay, you're not getting enough oxygen, well, then that's not something the flu typically does. That's something unique to COVID-19. And another symptom that people have experienced is the loss of taste and smell. Right? Maybe if your sense of smell or your sense of taste has changed, then that seems to be another sign that you may be infected with COVID-19. So who do we have to look out for? Well, first of all, if you're someone who takes care of someone who's infected, whether it is a loved one or whether it is through your career, your job, then you are considered high risk. So if you live with someone who has the virus, or if you are providing care in the form of a nurse, a doctor, or pharmacist, whoever, but if you work with those or provide care to those who have been infected with COVID-19, then you are at risk. If you have been exposed to someone's saliva or air droplets, through, let's say you kiss your wife or your husband or whatnot, and they have the virus, then of course you are at a greater risk. Now, of course, outside of those categories, the elderly are, that's one group that is at great risk for severe complications. Now, this is really because they struggle with poor health. Just a question that I'd like to ask the audience: how many of you heard about, what happened in New York State with the nursing homes? Just with a show of hands. Right. Okay. So most people seem to have heard about that. So the nursing homes, in which people were, when this started, they were trying to admit them into hospitals, but I guess there was an edict, a law passed that said they had to be kept in the nursing homes, and unfortunately, that it spread like wildfire through nursing homes and resulted in thousands of seniors dying due to this disease. So. The elderly are certainly a category of people that we need to look out for. But we also have to be mindful of those who have chronic diseases. So that is if you're struggling with diabetes, obesity, heart conditions, chronic kidney disease, or if you are someone who just has a suppressed immune system, right? So it could be due to cancer, it could be due to AIDS, HIV. If your immune system is suppressed, maybe you're taking steroids. If your immune system is suppressed, then you are at a high risk of catching or succumbing to COVID-19. Another category that I want us to talk about are pregnant women. This is actually interesting because pregnancy puts you at a greater risk of complications than a woman who is a non-pregnant woman. According to the CDC, they found that pregnant women were more likely to be admitted to experience severe COVID-19 illness, and they were more likely to enter the ICU at 3 times the rate as non-pregnant women. Now, the ICU is the intensive care unit. So in order for you to get in there, then you have to be experiencing severe symptoms. Now, they also found that they had a higher mortality rate. Pregnant women had a higher mortality rate to COVID than non-pregnant women. Now, there is some good news in all of this, is that generally when a pregnant woman gets COVID and she recovers, the child is usually fine. You know, the fetal child is protected. He's in the amniotic sac. So the virus has not been shown to penetrate and infect the child. So that's the good news. So how do we diagnose COVID-19? But before I go into this, I'd like to ask, the audience a question. How many of you have gotten tested? Teresa has gotten tested. Teresa, could you share your experience, please? I always love to hear other people's experiences with what they felt, what they thought, what was done to them.
Actually, it was easy. They just swabbed my nose the first time. And then the second time I did it, I pulled up to the drive-in window at CVS and they gave me the kit to swab my own nose and to put it in the container and hand it back to them. Mm-hmm. So it was simple.
Excellent.
Easy.
Excellent. Thank you so much for sharing that. Yeah. So generally that's the experience that I found when I ask people, when I ask the audience this question. Most people haven't, it's not difficult. It's not scary. Most people have had a decent time. I've had a few people, who have told me that, maybe the person went too far up their nose, but it may be due to a lack of experience. So please, I want to encourage everyone here, do not hesitate to get tested. It's not that scary. It's certainly not that bad. But if you want to find out where to test, you can go on the CDC website. You can go to your local health department. There are private companies out there. There are even certain pharmacies, as Teresa mentioned. CVS does it. I believe Walgreens may also do it. There are urgent care centers that do it, and there are community testing centers that will offer tests. I know me, for example, I'm working with several churches in the area, some friends of mine, and I will go to a church and we'll, test people free of charge, by the way, free of charge. So we'll test people. And so there may be someone doing that in and around your community, or maybe we'll have to come out there and do it. But there are 3 tests that are being offered for this. The first one is the molecular test, or the PCR test. The second one is the antigen test. And the third one is the antibody test. Now, the molecular test, the PCR test, is my favorite. I personally think it's the best. Now, what it does is it tells you whether you are infected with COVID at that very moment, which is great. It's available as a nasal or throat swab, or maybe even a saliva swab. What I like about this is it is the most accurate, okay? And you'll get your results, within 4 hours to up to a week. But to be fair, for most people, they understand, they get the results within 24 hours. 48 hours is the most. I've never heard of anyone waiting a week to get their results. So within 24 to 48 hours, they'll get the results. 24 hours being the latest. Now, there's the antigen test. The antigen test is a diagnostic test that also detects the presence of an active infection. So both molecular and antigen tests will test for a current infection. Okay, the antigen test is actually rapid. It's actually pretty fast. Now, it's available as a nasal or throat swab as well. The thing about this rapid antigen test is this. Positive results are very accurate. However, negative results are not. And oftentimes they will make you take a PCR test to confirm that you don't have it. So when it is positive, it's very accurate. But when it is negative, it's not very accurate, in which case they'll probably tell you to take a PCR test anyways to confirm that you don't have it. So, you know, again, why I believe the molecular PCR test is the most accurate. It's one and done. Now, the antibody test is a third option. Now, this one is a little different because it's actually testing for the presence of antibodies in your blood. Okay, this one is done through blood draw or finger stick, and you know, you'll get the results within the same day or up to within 3 days. But the thing about this is it only tells you that in the past you may have been infected with COVID-19. It does not tell you whether you are infected with COVID-19 today. Therefore, I personally don't see the value. I would encourage everyone who goes to get testing to ask for a molecular test. It is the most accurate. Now, let's talk about Operation Warp Speed. Just with a show of hands, who here has heard of the word Operation Warp Speed? Okay, Lynn, Susan, do any of you ladies care to share what may come to mind? What do you think? I know it was all over the news in 2020, but what are your thoughts? Lynn, can you unmute yourself? Hold on, you're actually still muted. Yeah, now there you go.
Sorry. When I heard the words Operation Warp Speed, I thought I'd be getting my vaccination within nanoseconds. Quick. It was coming to my community. Now, however, I know the truth. It's Operation Slow Speed.
It's not Star Trek. I'm sorry to tell you.
Right. So it's been frustrating. There was a comment on Facebook that we have 50,000 people in my county that need to be vaccinated. They're doing 400 vaccinations per week. So it'll only take 100 weeks to finish it. So,
assuming there's no snowstorms.
Oh, that too. So that's my feelings about our Operation Warp Speed.
Understood. Thank you for sharing. Susan, did you have something you wanted to add?
The only thing I have to add is I've been trying to get, I've been putting myself on lists, waiting lists for the vaccine, and it is not available anywhere. Like,
yeah,
I'm on every list that there is for the last 3 weeks, and every time they say, oh, call again. It just, everything is filled. So I don't know when I'll ever get it.
Yeah, the unfortunate thing is, I actually read this about a week ago that France, because of the unavailability of vaccines, in an effort to make sure everyone at least gets one dose, has changed their requirements from waiting for 3 weeks to get the second dose to waiting for up to 6 weeks to get the second dose.
Wow.
So that, this is not what the mRNA vaccines were supposed to do. They were supposed to make things a lot easier and a lot faster. And so I'm going to continue on just to show you why, and unfortunately, we are where we are. But Operation Warp Speed was a federal government initiative to really accelerate vaccine development, accelerate testing for COVID, accelerate the delivery of supplies, the development of different therapies, and the distribution of these supplies all over the country, all across the country. That's what Operation Warp Speed was all about. Now, because of the urgency, this led to the adoption of mRNA vaccines. Now, mRNA vaccines are actually new. We've never actually injected people with mRNA vaccines like we do with typical vaccines. And I'll tell you how. A traditional vaccine, whether you're getting the flu vaccine or the norovirus or just any other vaccine that you typically get, works like this. They take a virus, they weaken the virus, okay, or they kill the virus, and they take that virus and put it in a syringe and inject it inside of you. The fact that the virus is weakened or killed already means that it's not going to do much to attack your body. And so your body then gets to respond to that virus particle in your bloodstream. It gets to attack it, it gets to study it, and it gets to develop antibodies, which will later on identify that virus should it ever come across it. So that's how a typical vaccine works. It takes either a weakened form of the virus or the part of a virus or a dead virus and injects it inside of you in order to trigger an immune response and the development of antibodies. Now, this process is slower and more difficult. However, it can take up to 5 to 10 years. And now, if you compare this to the mRNA platform, the mRNA platform actually takes a genetic code. It takes the mRNA, which is the blueprint of a protein. Remember the corona or the peplomers, those crowns, those spike proteins on the COVID-19? Well, the mRNA sequence that codes for that is what gets injected inside of you. So it's not the actual virus, but what it does is your body then reads that genetic code and is then able to produce its own protein, okay? And what that means is your body gets to train itself on identifying the virus by its proteins, by the peplomers. Ideally, this process was supposed to be faster. It is faster, and so one of the reasons that both Pfizer and Moderna went this way was because theirs they could do it much faster than the traditional vaccine. Now, of course, Operation Warp Speed allowed them some leeway with accelerating their approval. mRNA vaccines or mRNA molecules tend to be easier to produce than the taking a weakened form of a live virus. And so once they take this mRNA genetic code, they'll inject it inside of you. Now, the promise was we would have a lot of doses, we'd be able to distribute it faster, and we would inoculate the entire country. The reality, however, has proven to be different. I believe only about 2.5% of the population to this date has received both doses. I believe those are accurate numbers. Now, let's take a look at the Pfizer and Moderna vaccine, just with a show of hands. I'm curious to know, has anyone gotten either 1 or 2 doses of the vaccine? Teresa has? Shannon? Okay. All right. Just asking Teresa and Shannon, which one did you get? Did you get the Moderna or did you get the Pfizer?
Oh, I got the Pfizer.
Okay.
I got the Moderna.
Now, have you ladies gotten the second dose?
I get my dose February 23rd.
Now that's going to be about 4 weeks, right?
No, that will be exactly 21 days.
Oh, 3 weeks, excuse me. Okay. Yeah. And Shannon, when are you getting your second?
I got my second dose a week ago.
Okay. And that was that 4 weeks from your first day?
It was, I think, exactly 28 days. So
28 days. Okay, thank you for sharing that. Okay, thank you so much for sharing that, ladies. So we have someone who's gotten the Moderna and we have someone who's gotten the Pfizer. So let's take a look at these mRNA vaccines, both of which, these were among the first to be approved, both of which are are mRNA vaccines, which means they carry the virus or the viral genetic code. That's what's being injected inside of you. The Pfizer one requires, well, both vaccines require 2 injections. The Pfizer one requires the 2 injections be 21 days or 3 weeks apart, whereas Moderna requires they be 4 weeks apart or 28 days. Now, as far as efficacy is concerned, Pfizer claimed it was 95% effective at preventing severe infections, whereas Moderna claimed to be 94.5% at preventing severe infections. So they're very similar. One difference, and I believe this is where Moderna has the advantage, is that with Pfizer, the vaccine has to be stored in a super cold fridge, right? A fridge that has the ability to go to -70 degrees. Whereas with Moderna, a regular fridge can store these vaccines 2 to 8 degrees Celsius. When it comes to Operation Warp Speed, their trial consisted of 43,500 people for Pfizer, and Moderna only tested on 30,000 people. Now, like all vaccines, you're going to have side effects. They can include pain or swelling, fevers, chills, tiredness, and even headaches. Now, here's what's interesting. Can you still get the infections? Can you still get COVID-19 despite having gotten the vaccine? What do you guys think? Yeah, well, the answer is yes. Yes. For both vaccines, despite having both those, you can still get COVID-19. No different than someone who is not vaccinated. The reason is, I'll tell you the reason after. Well, what about spreading it? Can you still spread COVID-19 despite having been vaccinated? Yes.
Yes.
So the reason being is, thank you. The reason being is the vaccine does not prevent you being infected. It prevents you developing severe symptoms. Remember the troubled breathing? Remember the bluish lips or face, right? Remember the excessive drowsiness? That's what the vaccine tries to prevent. What the vaccine is doing in reality is it is priming your body to better recognize the virus and therefore mount a better fight or mount up a better resistance. That is what the vaccine is doing. The vaccine is not preventing you from getting infected. So some people think that, fortunately, some people hold that misconception that once I get the vaccine, I'm done. And that's not it. This is why you still have to wear a mask, wash your hands, and keep a distance. You still have to take the same precautions as someone who is not vaccinated. Now, I want to shift the focus. Having talked about the vaccine, I'd like to transition into something that, unfortunately, I believe was grossly underlooked, and that is our immune system. So for the better part of 2020, every night when you would hear Dr. Fauci or Dr. Redfield or Dr. whoever get on television and talk about COVID-19, they would always talk about the vaccine. You know, for 10 months, they were talking about the vaccine. And though I understand why, I feel that we missed a golden opportunity to tell people that they needed to, take a look at how they were eating, the lifestyle they were living. They needed to look at their immune system. And I believe the immune system is key to surviving COVID-19. Let me give you an example. 2 people get COVID-19, okay? One, they both get sick, they both develop symptom. One dies and one lives. What's the difference between them?
The immune system.
Bingo. The difference between those who've survived and those who've died is the immune system. The vaccine does not make that difference. The immune system does. What the vaccine does is it gives the immune system some experience in fighting COVID-19. But the underlying factor is the immune system, ladies and gentlemen. Okay, so that's what I want to focus on. That's what I want you all to leave here knowing about. The immune system is that which is crucial to this COVID thing. And unfortunately, I wish, our leaders or our healthcare leaders had gotten on television and said, look, guys, we've got to have newfound respect for this immune system. We've got to boost it. We've got to stop doing the things that suppress it. Unfortunately, that wasn't done. I want to tell you why the immune system is so precious in keeping us healthy. Like any other country, our bodies has a military, and this military is responsible to protect and defend, okay? Our immune system is that military because it protects us from viruses, bacteria, fungi, toxins, free radicals, parasites, everything. It's the body's military. Much like a military, it has protective barriers, specialized soldiers, transportation system, manufacturing, station storage areas, and cleanup crews. Everything that a typical military has, your immune system has, because it does what a military does. I want to talk about some of these soldiers that we mentioned. So first of all, you have phagocytes. These specialize in finding and eating pathogen. You've got B cells that create antibodies against these pathogens. You've got helper T cells that drive and coordinate the immune response, and they activate B cells and killer T cells. And of course, what I believe is the star of the show, you've got killer T cells. These guys specialize in attacking and killing cells that have been infected by COVID-19, by the virus. Now, this is actually crucial once you understand how viruses operate, right? Because once you know how viruses operate, you will have newfound respect for the role and the function of killer T cells. Now, you have a lymphatic system, which is a great part of the immune system, this military. Now, this consists of organs such as your tonsils, your lymph nodes, your spleen, your thoracic ducts, the sternochyli, and the thymus. Now, just a quick question for the audience. How many of you have heard of have had your tonsils removed?
Yes.
Okay. What were they saying, if you don't mind sharing, Jack? What were they saying about tonsils? Were they saying that, I believe it was vestigial, we didn't need it or something?
It was a long time ago,
Mm-hmm.
and I was 5. Yes, they said that I didn't need them.
Right. And that was a huge mistake. Everything, I think as we've grown and as we've gotten better with science and research and understanding the body, we've come to understand that everything that is within us has a function, has a role. And I think that, the idea that, they used to say your tailbone, you didn't need it, your tonsils, you didn't need it. They didn't understand. That's what it was. They didn't know what it did. And so they just chopped it off and said that, hey, it doesn't do anything. But the truth is, it does. We know that it's a critical part of our immune system, of our immune defense. Okay? So don't let anybody tell you that some part of you is not important. It is all important. The issue is they don't know, or we don't know, or whoever's telling you that it's not important, they just don't know the value of it. Okay, that's the issue. But these organs support the body's defenses by producing the soldiers, storing them in barracks, transporting them from battle site around to the different battle sites around the country, and then employing the cleanup crews. Okay, you see that green network of lymphatic capillaries, right? That's the interstate highway that your body uses to send soldiers. Okay, so everything that you're seeing here is critical for your survival. So how do viruses operate? Well, here's something interesting about viruses. Viruses are a bunch of mooches. Okay, they can't actually survive on their own. They actually need you. They need a host to survive. They can't reproduce on their own. They need to mooch or leech off of you. And so here's how they do it. the virus will use its protein on the surface to latch onto a cell, one of your cells, and it allows it to enter that cell. Okay, and what the virus will do is it will release its genetic material and trick your cell into replicating it or making copies of that genetic material, thus producing more virus particles, which are then released into the rest of the bloodstream to go and infect other cells. This is how viruses operate. They need you more than you need them. Well, we don't really need them, right? They hijack your cells and they mislead them or trick them into creating new viruses. Okay, so the ease at which a virus is able to replicate, okay, or transmission into new cell is how viruses survive. And so the easier the transmission, the more virulent the virus will be. And this is what we have with COVID-19. It's able to do this masterfully. Now, why did I say the killer T cells are so important? Because if you remember what I said these types of cells, they don't necessarily just attack the virus, but they'll actually attack the cells that have been hijacked, the virus factories, okay? They'll attack those and they'll destroy them. And this is important because killing one virus is one thing, but you want to stop the factory that is producing all of these viruses. So let's talk about how we can improve our immune system. So there are several things that you can do right now to improve your immune system and make sure it stays in tip-top shape. The first thing you can do is sleep. For an adult, it's typical or it's recommended to get at least 7 hours of sleep. For teenagers, it's recommended to get 8 to 10 hours of sleep. For children, up to about 14 hours a day or a night. What you want to do is you want to eat plant-based foods, eat vegetables, eat green leafy vegetables, eat whole plant foods, typically high in vitamin C and antioxidants, fiber, all of which can lower susceptibility to illness. You want to eat healthier fats, such as olive oil, omega-3s, which are highly anti-inflammatory. You want to eat fermented foods or at least take a probiotic. Fermented foods are things such as sauerkraut. What you have to understand is that gut health and your immunity or your immune system are inexplicably linked. They're interconnected. Okay, so fermented foods and probiotics can bolster or improve your immune system. Limiting the amount of sugar we consume. Okay, as Americans, we consume way too much sugar, but sugar actually suppresses the immune system by contributing to chronic diseases. Therefore, lowering sugar intake can decrease your overall inflammation. You can even exercise. Exercising gets your heart flowing, your blood pumping, okay? Or get your blood flowing, your heart pumping. Excuse me, I said that backwards, okay? And so that has several beneficial effects on the body. It helps with turnover. It actually helps with the healthy turnover of immune cells, okay? Meaning retiring the old immune cells and getting a brand new crop of young immune cells. So staying hydrated is also important. A lot more important than just drinking because of thirst. Hydration can actually help you cleanse by flushing out the excessive toxins in your body. And it also helps your blood transfer nutrients into the cells. And of course, you want to manage your stress level. This is through meditation, through prayer, through just avoiding stressful situations or stressful people. You want to bring down your stress level because stress weakens the immune system. So I want to talk about our food, what we've been eating, and how it contributes to the immune system. So today in the developed world, in America, our soil has become depleted in deficient. So this is because crops, livestock, and even erosion deplete the soil of their nutrients. So each time you plant, let's say you plant a ear of corn, the roots have to reach even deeper in order to suck up enough nutrients to grow. Okay, we no longer do the practice of letting the land rest and replenishing itself. Now, of course, this is due to modern intensive agricultural methods. Many growers are not letting the land rest. They're not replenishing these nutrients in the soil. And so the food that we consume many a times does not supply us with as many nutrients as it once did in the past. So we're getting a lot more food, but many a times we're getting less nutrients with that food. Now, of course, micronutrients are required for the immune system to function properly. And just to give you an example, a deficient in any micronutrient can suppress the immune system and lead to disease. I'll give you an example. I'll give you several examples. A deficiency in B2 or riboflavin can lead to stunted growth and poor skin. A deficiency in B12, cyanocobalamin, can lead to anemia. A deficiency in ascorbic acid, vitamin C, can lead to scurvy. A deficiency in vitamin D, calciferol, can lead to rickets. A deficiency in iodine can lead to goiter. And a deficiency in potassium can lead to excessive bleeding. As you can see, these are just a few of the many, but a deficiency in any of those things, in any vitamin or in any mineral, will contribute and inexplicably lead to the development of some disease, some way or shape or form. So when we talk about nutrients, we have to understand that these micronutrients work together for the protective activities of the immune cells. So you can't send soldiers into battle without giving them bulletproof vests and weapons and bombs and tanks, right? So likewise, your immune system is not as effective if it doesn't have the things that it needs. And it needs these nutrients. Vitamin A, C, E, D, B6, and B12, and folic acid are known to be able to boost your immune response. Trace minerals such as iron, zinc, copper, and selenium can also boost the immune response. These nutrients are essential for antibody production. Okay, now there's also another category of nutrients that I want us to think about. They're called antioxidants. Antioxidants are actually responsible for removing free radicals in the body. And what free radicals are, these are unstable molecules that are found typically when you eat burnt foods like burnt meats, or if you smoke, or if you barbecue a lot and you're letting the grill heat hit you in the face. Okay, or if you're just eating, let's say, canola oil or something like that, bad oils. Okay, these unstable molecules damage healthy cells, including your immune cells. So the intestinal tract is the largest organ in the immune system. Okay, remember how I said the gut or gut health was interconnected with your immune system? Well, that's true. That's because the gut is the intestinal tract is the largest organ in the immune system. Now, of course, what is recommended here is to take a good probiotic, because the microbes can help keep the good microbes can help keep the bad microbes in check. Probiotics can also enhance the immune function against bacteria, viruses, and even fungi. And it can also improve digestion and gut health. Now, the star of the show, the one that I want us to focus on. Now, of course, I mentioned, zinc and all of these other things, but the star that I want us to focus on is vitamin D, and there's a reason why. Vitamin D is a fat-soluble vitamin, which means that it can be stored in the body. It's available as two forms. There's D3, cholecalciferol, and D2, ergocalciferol. The D3 form is the one that will raise your blood levels of vitamin D. It's more effective at raising that. Now, here's an interesting thing about how vitamin D is made. It's produced when cholesterol that's made by your liver goes up to the skin, and that cholesterol will then interact with the sunlight that's hitting you. And the sunlight turns cholesterol into vitamin D. Now, here in the US, up to 40% of Americans are deficient in vitamin D. Okay, now, of course, in the Northeast, it's even worse because the lack of sunshine can affect how much you produce. Somebody in California likely gets more sun than someone in New York State. Now, what is interesting about that, since 40% of the population, when you break it down by ethnic group, you're looking at about 82% of Black adults. You're looking at about 56% of Hispanic adults, and you're looking at about 34%, 35% of white Caucasians adults. Okay, so this is crucial in order to understand everything that's been happening, because for the better part of a year, people have been petrified to go outside, even in front of their yards. They've been told to stay at home and lock the doors. Now, we know vitamin D is good for our bones because we've seen the milk commercials, right? They keep saying that milk is good for your bone. It helps give you strong bones. So we know that. And it does so by helping the body absorb calcium. It strengthens bones. But did you know that vitamin D can also activate certain genes? That's right. Which means that it can also help with cancer. It helps, vitamin D helps reduce depression. It reduces your risk of type 1 diabetes and even cancer. Studies have shown. So one thing that's interesting about vitamin D is it decreases your risk of respiratory infections, including COVID-19. Now, this is just a snippet of everything you're going to see to the right there. Okay? Vitamin D, ladies and gentlemen, helps your immune cell fight off respiratory infections, including COVID-19. That's what vitamin D does. Now, to conclude, according to the CDC, they want us to social distance, wash our hands, and wear a face mask. And now that vaccines are available, they advocate that we get inoculated. Now, what symptoms you will need to look for are respiratory symptoms, things like fevers and chill, but the differentiating factors from the flu are things such as difficulty breathing, confusion, and even fatigue. Now, this applies to everybody, but the groups that are most at risk include those in nursing homes, those with chronic diseases, and certainly minorities, especially blacks, of course, but Latinos as well. So what's recommended is that you get tested often and you consider taking the vaccine. Now, the thing to remember, caution, you can still catch and you can still spread the vaccine. Now, with regards to everyone's responsibility is to improve their immune system. The vaccine is not the end all be all. And you're going to do that by making lifestyle changes, and you're going to do that by making dietary changes and address any vitamin D deficiency you may have. So that hopefully next time we have a day where the sun is shining, you don't have to go out in public, but you can sunbathe in your, throw up a lounge chair and just stand there and lay there in front of the sun, in front of your home. It's crucial. And when you can't do that, then consider taking a vitamin D supplement. We've reached the end of our seminar. I want to thank you all. I'm Dr. Cedrick, and I want to thank you all, and certainly Janet Rohr for facilitating this. And I look forward to bringing any one of my 11 other seminars to you guys. So this one was COVID-19 and immune health. We've got seminars on just about everything, and we're constantly adding more steps, more topics. So if anybody would like me to make personal recommendations about with regards to supplement, I'm going to put my store, wellevate.me/Dr. Said. I'm going to put my store in the chat box. And if anybody would like to leave me a feedback, I'm going to send out the link. I'm certainly going to send it to Janet. But
great. And I'll be glad to pass it on to anyone who asks.
Thank you. Now, does anyone have any questions?
Oh, how am I sideways?
Hi, Susan. Wait, who's talking?
I was just going to ask a question. I was just going to ask if your blood type has anything to do with COVID.
See, I haven't heard that your blood type has anything to do with COVID. I mean, I've heard that, I've heard something about blood type, but I didn't know what to make of it. So I didn't really follow it. So I hesitate to say much about it. But I do know this: if I have COVID and I sneeze in front of your face, chances are you're going to get it. Okay. Right? So I don't know that blood type determines or has any impact in that scenario. I've just breathed out my virus particles on you. So I think they're going to have a good time colonizing your lung and your respiratory tract. But good question. Teresa?
I have a question. A friend of mine, her doctor told her that she can get the first shot, and as long as she gets the second shot within 42 days, that's fine. So where are doctors getting this information? Because when I look on the website, the CDC website, it's really specific about the time frame for vaccines.
I don't know where they got that information, to be honest with you. I've been told 21 days and 28 days respectfully. Now, earlier I mentioned that France has had to extend it.
Right.
Due to a lack of vaccines and their desire is to give everybody at least one dose.
Okay. So, all right. So that's good to know. I just was wondering where they're getting this information, and then,
I don't know. Good
telling
question.
people. Thanks.
Mm-hmm.
So I have a question as far as, with Pfizer and Moderna being like 3 weeks, 4 weeks apart for the doses, but yet if they feel that they want to try and get as many immunized as possible and feel that at least getting one dose is okay, but I've understood that like one dose is maybe 50% protection. That's why you need the second. So
yeah,
is there a point beyond which that one dose, if you don't get it within like 4 to 5 to 6 weeks after, would you have to start all over again? I mean, how effective is it going to be once you get the second one if you wait that long, or if they caused you to wait that long?
Now, with everything that's been happening, it may be that they don't know everything that pertains to this vaccine, because again, they did it in 10 months. They didn't necessarily take the 5 to 10 years that a typical vaccine takes, where they study everything and they have a very good idea of when to take the vaccine. So it may be that the 3 to 4 weeks that they give out is what was shown in their data. But of course, these things were really rushed. They were. So with anyone changing the days or the frequency of getting the vaccines, I don't think so. I think once you take Moderna, you kind of have to take the second Moderna dose. Once you take Pfizer, you have to take the second Pfizer dose. I'm not sure that you have the luxury of mixing and matching.
No, that wasn't what I figured. I was just wondering if it was going to be less effective if you had to wait so much longer, if they gave away the second doses to somebody else to have as their first dose.
Oh, I see. Getting the first dose, you're right, it gives you something like 50%. Getting the second dose brings it up to about 94, 95% respectively. Is it less effective? So what I know is this. Typically, antibodies are present in your bloodstream for about 4 months. So it may be that if you get it within 4 months, you're still going to get somewhere in the 90s. Okay. But I would assume theoretically it should not be an issue, because your body knows how to identify those viruses. But even I thought it strange that you have to wait 3 weeks and 4 weeks, but that's the research that they did, and that's what their studies or their trials proved. So who are we to question, So we kind of have to just obey them. But that's actually very interesting. I'm not sure whether I would assume the reason they emphasize everyone gets it within 3 to 4 weeks is so that the efficacy is greatest. Okay, so I would lean towards, if you wait beyond those days, you're probably going to get less or lower efficacy. That was an excellent question, by the way.
Thank you.
I have a question about using kefir as a probiotic. What is your feeling about that?
Kefir's great. Any sort of fermented food. Kefir's fermented, right? Mm-hmm. Is it fermented? Yeah. Anything that's fermented is actually really good. Now, of course, the problem with fermented foods, is they taste dare I say it, they taste awful.
Yes, absolutely.
You know, I will tell you this. I tried this new drink called kombucha.
Mm-hmm.
Oh my goodness, I couldn't get this thing down.
Yeah,
I'm like having like burping and you know, I mean, the taste wasn't that bad, but I wasn't, you know, I figured it was going to be, it would go down smoothly. Okay. Not what I expected. Not what I expected at all. So, you know, things like kefir, sauerkraut, you know, kombucha, you know, these fermented things. Fermented means they have bacteria in them, and these bacteria are usually probiotics. You know, if you can stomach the taste, you know, God bless and enjoy. But I'm someone that likes to savor what I eat or drink, so you know, I'll just take my probiotic capsule and stick to my own, you know, to enjoying my food.
Well, and I would, you know, I would love to have a recommendation on a probiotic capsule. How do you evaluate which one is best for you?
Yeah, sure thing. So right now in the chat room, okay, I'm gonna put the link to my online store, Wellevate. Just go in there, sign up. It takes 10 seconds. You just put your email, and there I can then send you a recommendation directly through that. So it's there. And this is my website, drced.com.
Great. Thank you.
Yes, but great questions. Next.
Anybody else?
Actually, I have just one more. I was wondering if my brother-in-law is in the hospital with COVID pneumonia.
Mm-hmm.
So what do they treat? Do they treat the COVID or do they treat the pneumonia?
That is actually interesting. This may be the first time I've heard of that.
Okay. Yeah, not many people have it. I did some research.
Yeah. I'm not sure that I know what to tell you, because let me just think about this. COVID-19 affects your lungs, and pneumonia is when your air sacs are filled with fluids. You know, you would think both of these things would be fighting for supremacy in there.
Yeah.
It may just be that they had pneumonia, but they also got COVID. And since both act in your lungs, you know, they have to treat the pneumonia, you know, they have to treat the pneumonia separately. They have to give something separately for the pneumonia, specific to the pneumonia, and something else specific to the COVID. It may just be they're giving them, you know, remdesivir for the COVID-19. I don't think the two are combined or the two are caused simultaneously, because you're looking at two different particles causing two different diseases in the same area.
Okay.
Yeah.
And can they give him a vaccine even though he still has COVID?
The vaccine for what?
For COVID.
Well, from what I understand, when you do have COVID and you survive, they'll often say you have antibodies, right? And so theoretically, those antibodies are supposed to protect you from getting COVID again. However, we now have different strains. We've got the English strain of the COVID-19. You know, it likes its tea at noon. That was a joke, by the way, the English strain. You've got the, I believe, the Australian variant. You've got the South African variant. So I think they're just advocating for everyone to get the vaccine. However, I have yet to see whether the vaccines protect against these newfound strains, because the vaccines were developed before these strains came about. So, you know, I don't know that they work or how effective they are against a new strain. So I really cannot speak to that.
Okay. Thank you.
No problem. Good question.
I have one more question. Is there something that's very helpful to help absorb vitamin D better? Or is there anything that might limit your absorption?
Do you mean absorption of vitamin D in terms of a tablet or in terms of sunlight? Because I mentioned that the body produces vitamin D when you stand out into the sun.
Well, that's you know, you can just get that naturally. But if you're let's say you're taking a calcium tablet with vitamin D, like, is there anything else that would help to absorb for that?
Oh yeah. I think I understand what you're saying. Here's what I would do. I am a big believer in liquid supplements over tablet supplements. When it comes to absorption, typically we absorb about 20 to 25% of the tablets that we take in. Whereas with liquids, we absorb over 90%. Especially if you're looking at colloidal or like the liquid or finer particles. So they're able to be absorbed in your gut a lot easier. And they're able to enter the cells a lot easier than tablets because, and again, it depends on the quality of vitamins that you get. Some vitamins are full of excipients, some are synthetic. You know, I tend to prefer food-based vitamins, such as Mega Food is one type of company, food-based, you know, where they're extracting these vitamins from foods, from whole foods. You know, there are many whole food companies out there, but I tend to prefer those because at least your body will recognize the source of the nutrient and be able to extract it a lot easier than that which is synthetic. Synthetic vitamins, you know, many times the body has to modify them and add to them in order to make them bioactive in the body, in order to be able to use them. But as far as absorption, I know vitamin D with calcium works. I believe with potassium as well works as, you know, I've seen that combination. It helps with absorption. It was vitamin D with K or K3 or something like that. Let me see. Yeah, vitamin D with K2, with vitamin K2.
Okay. But you said like a Mega Food is a brand and it extracts it from plants?
Yes, from whole foods. So, by the way, I said potassium. I meant to say menaquinone. K2 is menaquinone. Okay, it's vitamin K.
Okay.
Okay, so I wanted to correct myself with regards to that. So what I can do is, if I see Teresa has put in her email, if you all would put in your emails in the chat, I will send you a link to the store and I can actually give you a recommendation. I think that's more accurate. Is that okay with you, Robin?
Yeah, that's good.
Yes.
And you said to put our email address?
Yeah, in the chat box, if you would put your email address. I'm gonna send you both or everyone a contact with a list of supplements that I recommend for COVID-19. I mentioned these supplements in my conversation, in my presentation. Okay.
And Teresa, did you have another question? I think.
No, I was just going to say goodbye and thank you so much. I really, as you enjoyed it, I learned a lot. Thank you. Thank you so much.
I
Great
appreciate you, Teresa. Well,
Always.
spread the word. Spread the word.
Thank you.
Thank you. And thank the Holland Township Public Library and Janet for putting this together, and solicit her. I have about 10 more seminars. So just tell her you want me to come back with, you know, I don't know, diabetes or something.
We'd love to have you back. Thank you so much for this wonderful information. I took notes, and I will be in touch with you. And thanks everybody for attending tonight. We really appreciate it. And I know everyone enjoyed this. I learned so much. So thank you so much.
Yes,
Yes.
and I believe it is recording. So,
Yes,
you know, I hope that, you know, if you put it on Facebook or Twitter or whatever, please just send me a link to it. I love to see how it, I love to look back and see how I look. No, but I really do. I really do. So just share that.
The library has a YouTube channel, and as soon as we cut and paste, usually the librarian cuts out where I'm, you know, asking you how to pronounce your name and, you know, and getting the technology things. But as soon as that's ready, I'll send you the link to that. And thank you. And anyone else who wants to review it again, just go to the library website, and there's a little icon for YouTube, and you can watch it again.
Thank you.
So much.
Yes.
Thank you.
Thank you, ladies.
Thank you very much.
Thank you.
It was wonderful.
So
Bye-bye.
Wonderful.
Blessings.
Bye.
Absolutely.
Bye-bye.
Bye-bye.